Mary woke up at 5:47 a.m. She reached out to nudge John, just like she had every morning for 38 years of marriage. But his shoulder was cold. The coroner's report said, sudden cardiac death during sleep. And her family repeated that same phrase we all hear. At least he went peacefully. In his sleep. He didn't feel a thing. But did he? I know what you are thinking right now. You are thinking about that slight chest pressure you felt last Tuesday. You are thinking about how your spouse snores so loud it shakes the walls, and how you sometimes lie awake in the dark, wondering if their heart is just tired. You brush it off. You blame it on getting older, on stress, on a heavy dinner. But here is the truth nobody tells you about the hours between midnight and AM. For many hearts, the middle of the night is not a time of peace. It is the time of truth. John's body had been leaving clues for months. 7 specific silent habits. And the number 1 habit is probably sitting in your medicine cabinet right now. We left off talking about that medicine cabinet. We will get there. I promise you. But to understand why that number 1 habit is so dangerous, we first have to understand the battlefield. And yes, for a heart that is quietly struggling, the night is a battlefield. Before we go any further into this, let us make a quiet agreement between us. We are 2 adults having a serious conversation about life and longevity. Everything we discuss here today is strictly educational. I am sharing medical realities and physiological truths, but your body is your own. You must always consult your personal physician before making any changes to your routine, your diet, or especially your medications. We are here to build awareness, not to diagnose. Now, let us talk about how we treat our bodies when the sun goes down. Think about a house at midnight. The lights are turned off, the doors are locked, the thermostat is lowered. The house is designed to power down. Your cardiovascular system is designed to do the exact same thing. In a healthy body, when you go to sleep, your blood pressure is supposed to drop by about 10 to 20%. Cardiologists call this a nocturnal dip. It is the only true rest your heart gets. It is the time when the engine idles, when the vessels repair themselves, when the stress of the day is washed away. But what happens when we refuse to let the house power down? What happens when we leave all the appliances running, but turn off the lights and pretend everything is fine? This brings us to the first silent trap. Let us call it Habit 7, the heavy, late American dinner. I have heard the story 1,000 times from grieving spouses. They tell me, he worked so hard. He would come home exhausted at 7 or 8 at night. Dinner was his reward. And it is true. For many of us, especially in our 50s and 60s, dinner is the only time we actually sit down. We eat late, and we eat heavy. A large steak, potatoes, maybe some processed sides, a rich sauce. We think the only consequence is a slightly tighter belt. But we are ignoring the invisible element, the sodium. Imagine your blood vessels as a complex plumbing system. When you consume a heavy, high-sodium meal late in the evening, that salt acts like a chemical sponge inside your bloodstream. It holds onto water. It demands fluid. Now, combine that with gravity. All day long, while you're sitting at a desk or standing, fluid naturally pools in your lower extremities. When you finally go to bed and lie flat, a massive physiological shift occurs. All that fluid in your legs, amplified by the heavy sodium load from your late dinner, suddenly rushes back toward your center. It returns to your chest. Your heart, which was preparing for that crucial nocturnal dip, that essential period of rest, is suddenly flooded with excess volume. Instead of idling, it has to work overtime. It has to pump harder and faster just to manage the fluid overload. You're asleep, dreaming, thinking you're resting. But inside your chest, your heart is running a marathon in the dark. Night after night, year after year, this silent strain stiffens the arteries and exhausts the cardiac muscle. And often, we make this strain infinitely worse with Habit 6, the innocent nightcap mixed with modern chemistry. This is perhaps the most deceptive habit of all, because it feels so relaxing. You have had a long day. Your joints ache a little. Your mind is racing with worries about retirement, about the kids, about the state of the world. So, you pour a glass of wine, or maybe 2 fingers of bourbon, just to take the edge off. It is just one drink, we tell ourselves. It helps me unwind. But here is the reality of aging in the modern world. That one drink rarely enters an empty system. By the time we cross the threshold of 50, many of us are taking something else. A prescription for anxiety, a daily antidepressant, an over-the-counter antihistamine for seasonal allergies, or a dedicated sleep aid because we just cannot seem to stay asleep anymore. When you mix alcohol, even a small amount, with medications that depress the central nervous system, you are not just relaxing, you are creating a chemical collision. Think of your airway like a garden hose. When you are awake, the muscles in your throat keep that hose firm and open, allowing air to flow freely to your lungs. But when you combine alcohol with sedating medications, those muscles relax too much. The hose becomes floppy. As you fall into a deep, chemically induced sleep, that airway begins to collapse. You stop breathing for 10 seconds, 20 seconds, maybe longer. Your oxygen levels plummet. Your brain, sensing that you are suffocating, hits the panic button. It shoots a massive surge of adrenaline directly into your bloodstream to shock you awake just enough to take a breath. Imagine being startled by a loud alarm clock every 5 minutes, all night long. That is what your heart is experiencing. Massive spikes of adrenaline, sudden surges in blood pressure, all while you are completely unconscious. This is the perfect storm for a nocturnal arrhythmia. This is how a heart that seemed perfectly fine at dinner time is pushed to the absolute brink by 3 o'clock a.m. We do these things not because we want to harm ourselves, but because we are seeking comfort. We are seeking rest. But the body has a language of its own, and it will always try to warn you when the burden becomes too heavy. It will send you signals in the middle of the night. Signals that most people completely misinterpret as just getting older. You ask for the warning signs, so let us look at the reality of what happens in the dark. We often believe that if something is seriously wrong with our bodies, we will feel pain. We expect a dramatic cinematic moment, a clutching of the chest, a sudden shortness of breath. But the heart is far more subtle than that. It whispers before it shouts. Let us talk about the 2 o'clock a.m. walk down the hallway. You know the one. You wake up, look at the glowing red numbers on the clock, let out a quiet sigh, and head to the bathroom. And then, perhaps, you do it again at 4:30 a.m. We call this habit 5, normalizing the midnight drain. If you are a man over 50, you almost certainly blame your prostate. You might have even seen a urologist who told you it is slightly enlarged, which is par for the course at our age. If you are a woman, you blame that cup of chamomile tea you had while watching television. We brush it off. We tell our friends, it is just a tax we pay for getting older. But what if your bladder is not the problem at all? What if your bladder is just a messenger, delivering a desperate plea from your chest? Think about your feet and ankles at 5 o'clock p.m. when you take off your shoes after a long day. Do you notice deep indentations from your socks? Are your ankles a little puffy, a little swollen? During the day, gravity is relentless. It pulls fluid down into your lower extremities. Now, connect this to what we discussed earlier about lying flat in bed. When you finally lie down, gravity is no longer keeping that fluid in your legs. It all shifts back into your central circulation. A strong, resilient heart pumps that extra volume effortlessly, distributing it where it needs to go. But a heart that is tired, a heart that is quietly struggling with early stage, hidden failure, simply cannot handle the sudden flood. It becomes overwhelmed. So, the body, in its infinite wisdom, activates an emergency release valve. It diverts that excess fluid directly to your kidneys to be filtered out as quickly as possible. You're not waking up multiple times a night because your bladder is weak or just because of your prostate. You're waking up because your heart is using your kidneys to keep itself from drowning in its own fluids. This is called Nocturia, and when paired with swollen ankles, it is one of the most ignored red flags in modern medicine. We translate the body's language incorrectly. We call it aging when we should be calling a cardiologist. This dangerous mistranslation leads us directly into habit 4, the illusion of the Iron Man. This is the habit of unchecked, unmonitored high blood pressure. I cannot tell you how many people I have spoken to, especially men of a certain generation, who sit with their arms crossed and say, I feel fine. I work hard. I mow my own lawn. I don't get sick. My grandfather ate bacon every day and lived to be 90. They wear their avoidance of the doctor's office as a badge of honor. They believe that if they do not feel sick, they are not sick. But cardiovascular disease does not care about your work ethic. It does not care how tough you are. High blood pressure is the ultimate silent mechanic of destruction. It does not give you a fever. It does not make you cough. It does not make you dizzy until it is often too late. It just quietly, relentlessly, damages the plumbing. Imagine the pipes in an old house. If the water pressure from the street is cranked up too high, the pipes do not burst immediately. For years, they just take the beating. But inside, the constant high pressure flow is scouring the lining of the pipes, creating microscopic tears. In our bodies, cholesterol and calcium rush in to patch those tears, creating plaque. The arteries harden. The heart muscle thickens because it has to push against that immense resistance every single second of every single day. You would never drive your truck for 5 years without changing the oil, checking the tire pressure, or looking under the hood. You take it in for service every 10,000 miles because you know machines need maintenance. Yet, your heart beats 100,000 times a day. It pushes blood through 60,000 miles of blood vessels. And millions of us let this miraculous engine run for decades without a single diagnostic check. We let the pressure build in the dark. We let the arteries stiffen in silence. We assume that because we cannot hear the engine knocking, everything is fine under the hood. We ignore the silent signs because they are easy to dismiss. But what happens when the signs are not silent? What happens when the warning is so loud it shakes the walls of your bedroom, yet we still treat it as a family joke? We left off talking about the loud signs. The signs that are so obvious they literally shake the walls of our homes, yet we somehow manage to ignore them. Let us talk about the noise. We will call this habit 3, treating the struggle for air as a family joke. You know exactly the sound I am talking about. The snoring that sounds like an idling freight train. The kind of snoring that eventually sends a loving spouse to the guest bedroom just to get a few hours of peace. It becomes a running joke at Thanksgiving dinner. Oh, you know John. He could wake the dead when he falls asleep in his recliner. We laugh about it. We buy expensive earplugs. We nudge them in the ribs until they roll over. But I need you to hear this clearly. There is absolutely nothing funny about a human being mechanically struggling to pull oxygen into their lungs. Snoring is not just a nuisance. It is the acoustic evidence of a collapsing airway. It is the sound of soft tissue vibrating violently because the passage for air has become dangerously narrow. And almost always chronic, loud snoring means you are breathing through your mouth. Here is a piece of human physiology that might change how you view your sleep forever. When you breathe through your nose, your nasal passages produce a miraculous, short-lived molecule called nitric oxide. As you inhale, this molecule travels down into your lungs and enters your bloodstream. Its primary job is to act as a vasodilator. It relaxes and widens your blood vessels. It is essentially a natural blood pressure medication produced by your own body, designed to protect your heart while you sleep. When you sleep with your mouth open, snoring heavily all night, you bypass this entire biological system. You rob your cardiovascular system of the very molecule it desperately needs to rest and recover. But the snoring is often just a prelude to something much darker. This brings us to habit 2, the silent choke, medically known as untreated sleep apnea. If you have ever stayed awake watching someone with severe sleep apnea, you know the absolute terror of the pause. The loud snoring suddenly stops. There is a heavy, agonizing silence. 10 seconds pass. 20 seconds. 30 seconds. Their chest is not moving. They are not breathing. And then, just as you are about to shake them awake, there is a violent gasp, a choking snort, and the heavy breathing begins again. During that terrifying silence, the oxygen levels in the blood are plummeting. The brain, sensing that the body is suffocating, hits the ultimate emergency alarm. It floods the nervous system with massive doses of adrenaline and cortisol. The blood pressure, which is supposed to be at its lowest point of the day, violently shoots through the roof. Imagine someone sneaking into your bedroom and terrifying you awake with a loud horn every 5 minutes, all night long. You would be exhausted, traumatized, and physically wrecked. That is exactly the level of mechanical and chemical stress your heart is enduring while you think you are just sleeping poorly. Major medical studies have shown us for years that untreated, Severe sleep apnea drastically increases the risk of sudden cardiac death in the middle of the night. It is not a sleep problem. It is a nightly cardiovascular crisis. If you are still here with me at this point in the video, I want to invite you to subscribe to our channel and follow us every day. We are building a community of people who refuse to just fade away, people who want to look the realities of aging in the eye and take control of their health with dignity and truth. It is a privilege to share this space and this knowledge with you. Now, let us get back to the most critical part of this puzzle. Because everything we have discussed so far, the heavy sodium, the alcohol, the unchecked blood pressure, the suffocating pauses of sleep apnea, they are all just setting the stage. They are loading the gun. But what pulls the trigger? We have finally arrived at the door of your medicine cabinet. We are about to open it and look at habit number 1. It is a combination of things you probably take every day. Things you trust, things that, when mixed with a tired heart in the middle of the night, create a perfect silent storm. Think about how you feel when you finally drag yourself out of bed at 6:30 a.m. For millions of Americans in their 50s and 60s, waking up exhausted has simply become the baseline of existence. We pour that first, heavy cup of coffee and tell ourselves that this deep, bone-aching fatigue is just what aging feels like. We blame it on a stressful week, on the economy, on the natural slowing down of the body. But true aging does not feel like a hangover you cannot shake. That profound morning exhaustion is not a symptom of getting older. It is the physical aftermath of a brutal nocturnal battle. Your body is exhausted because while your mind was unconscious, your heart and lungs were fighting a desperate, hours-long war for basic oxygen. And perhaps the most tragic part of this silent war is the burden it places on the person sleeping next to you. Your spouse knows the truth. They are the ones lying awake in the dark, staring at the ceiling, listening to the terrifying pauses in your breathing, silently counting the seconds until you gasp for air again. Yet, so often, couples enter into an unspoken agreement of denial. We do not talk about it the next morning because acknowledging it means admitting vulnerability. It means scheduling a sleep study, facing the reality of a SPAT machine, and letting go of the illusion that we are invincible. But pride is a terrible reason to leave your heart undefended. Ignoring the struggle for air is not stoicism. It is playing a dangerous game of roulette while you sleep. We have finally arrived at the door of your medicine cabinet. We are about to look at habit number 1, the silent trigger. To truly understand how dangerous this habit is, we first have to look honestly at how we age in America. When we were young, healthcare was simple. We had one family doctor who knew our history, knew our parents, and knew every pill we swallowed. But as we cross into our 50s and 60s, our healthcare experience fractures. We no longer have one doctor. We have a fragmented team of specialists who, quite frankly, rarely speak to one another. You become a collection of separate symptoms managed by strangers. You see a gastroenterologist for that stubborn acid reflux, and they prescribe a daily proton pump inhibitor, like omeprazole. You visit a psychiatrist, or perhaps your primary care physician, carrying the heavy, quiet anxiety of modern life, and they put you on a standard SRI antidepressant, perhaps a high dose of citalopram. A few months later, you visit the dentist for a complex root canal, or you stop by an urgent care clinic for a winter cough, and you walk out with a Z-Pak, a common antibiotic like azithromycin. And because you have been staring at the ceiling until 3 o'clock a.m., someone along the way prescribed a heavy sleep aid, like Ambien. You bring all these little orange bottles home. You line them up in the cabinet. You take them faithfully, exactly as directed by each individual specialist. You believe you are following the rules of good health. But here is the terrifying flaw in the system. Nobody looked at the whole board. Nobody asked what happens when all these disparate chemicals meet in the dark, inside an aging cardiovascular system. To understand the danger of this chemical collision, I need to teach you a medical concept that cardiologists monitor every single day, yet most patients go their entire lives without hearing about. It is called the QT interval. Think of your heart not just as a mechanical pump made of muscle, but as a highly sophisticated, incredibly delicate electrical grid. Every time your heart beats, an electrical current fires across the tissue. Imagine turning on a massive high-voltage spotlight in an old house. The light flashes brilliantly, that is the heartbeat, pushing blood to your brain and your toes. But before that spotlight can flash again, the electrical breakers in the house need a fraction of a second to reset and recharge. They have to prepare for the next surge of power. That crucial fraction of a second, that silent, invisible reset period between beats, is the QT interval. In a healthy, young heart, this reset happens almost instantly. But certain things can stretch that time out. They make the electrical reset sluggish and delayed. And if that reset takes too long, and the brain sends another electrical signal trying to force a heartbeat before the system is fully recharged, the entire grid short circuits. In your house, a short circuit means you blow a fuse and the lights go out. In your chest, a short circuit is a chaotic, violent arrhythmia. The heart stops pumping blood in a rhythmic motion and simply begins to quiver. This is often the exact mechanism behind sudden cardiac death in the middle of the night. Now, let us look back at those orange bottles in your cabinet. We have known in the medical community for years that certain very common, everyday medications have a specific side effect. They prolong the QT interval. They chemically slow down the electrical reset of your heart. Some widely prescribed antidepressants do this. Certain common antibiotics do this. Even some over-the-counter anti-nausea medications can stretch that electrical rubber band. Taking one of these medications is usually fine. The human body is resilient and adapts. But remember our fragmented healthcare system? What happens when you take the antidepressant that slows the reset? And then you add the antibiotic that also slows the reset? And you wash it down with the reflux medication that changes how your liver metabolizes all of it. You are stretching that electrical rubber band further and further until it is paper thin. Now, let us bring in the habits we discussed earlier. Let us build the perfect storm. You have a heavy, high-sodium dinner that floods your tired heart with excess fluid. You have a glass of wine mixed with your sleep aid, which relaxes your airway until it collapses. You are lying in bed. Your heart's electrical system is chemically stretched and highly vulnerable from the medications. And suddenly, because of the sleep apnea, you stop breathing. Your oxygen levels plummet. Your brain panics. It shoots a massive, desperate spike of adrenaline directly into your bloodstream to wake you up. Adrenaline is pure electrical chaos. It hits a heart that is already struggling to reset its breakers. The rubber band snaps. The grid short circuits. There is another shadow layer to this that makes it even more unpredictable. Some people are born with microscopic genetic defects in their heart's electrical system. We call them silent canalopathies. You can live 50 or 60 years, work hard, raise a family, and never know you have one. You feel perfectly fine, but your electrical grid is naturally fragile. When a person with a silent canalopathy takes the wrong combination of everyday medications, the risk of a sudden short circuit skyrockets. This is why a medication combination that is perfectly safe for your neighbor might be the exact trigger that stops your heart. I need to pause here, and I need you to listen to me very carefully. Do not walk into your bathroom right now and throw your medications in the trash. That is the exact opposite of what a mature, responsible adult does. These medications are necessary. They treat severe, debilitating depression. They cure dangerous infections. They heal bleeding ulcers. The danger is not the medication itself. The danger is the unmonitored combination. The danger is the blind spot. The danger is assuming that just because a doctor prescribed it, it is automatically safe to mix with everything else you are taking. We have diagnosed the problem. We have looked at the heavy meals, the alcohol, the blood pressure, the snoring, the apnea, and the chemical collisions in the medicine cabinet. We know exactly how the trap is set in the dark, but knowing the trap is not enough. We have to know how to dismantle it. We have spent this time looking into the dark, identifying the silent traps that wait for us when we go to sleep. But knowledge without action is just anxiety. We are not here to be afraid of the night. We are here to take control of it. I want to give you a specific, actionable nighttime protection protocol. You can start this tonight. First, we must change the mechanics of your evening. We implement the 3-hour rule. You must finish your last significant meal at least 3 hours before your head hits the pillow. And you must look critically at the sodium. If you are eating processed meats, heavy sauces, or restaurant takeout late at night, you are loading that chemical sponge. Give your body time to process the fluid shift while you are still upright, awake, and moving. Let your heart actually enter its nocturnal dip, rather than forcing it to run a marathon while you sleep. Second, we perform a chemical audit. Tomorrow morning, I want you to take every single prescription bottle, every over-the-counter sleep aid, every allergy pill, and put them in a bag. Take that bag to your primary care physician or a trusted pharmacist. Look them in the eye and ask one specific question. Are any of these medications, or the combination of them, prolonging my QT interval or depressing my respiratory system? Force the fragmented medical system to look at the whole board. You are the only one who can advocate for your complete chemistry. Third, we stop treating the struggle for air as a joke. If your spouse has moved to the guest room, if you wake up with a dry mouth and a racing heart, or if you feel a bone-deep exhaustion at 7 o'clock a.m., you must demand a sleep study. A SPAP machine is not a sign of weakness. It is not a defeat. It is a mechanical shield that protects your cardiovascular system from the trauma of adrenaline spikes. It is the difference between merely surviving the night and actually resting. Fourth, we establish a baseline. If you are over 50 and you have not had a simple electrocardiogram and EKG in the last year, schedule one. It takes 5 minutes. It is inexpensive, but it gives your doctor a direct map of your heart's electrical grid. It can reveal those silent canalopathies. It can show the hidden strain of high blood pressure. Do not wait for the engine to knock before you check the oil. Let us go back to where we started. Mary lost John on a cold Tuesday morning in February. The coroner gave her a piece of paper with a medical term on it, and her friends comforted her by saying he went peacefully. But the heaviest burden Mary carries today is not just the grief of an empty house. It is the agonizing weight of a single question. What if I had known? What if they had not laughed at the snoring at Thanksgiving? What if they had not assumed his midnight trips to the bathroom were just his prostate? What if someone had looked at the antidepressant, the antibiotic, and the sleep aid, and realized the electrical grid was about to snap? Mary lives with the echoes of those warnings every single day. You do not have to carry that burden. You do not have to leave your spouse with that question. Aging in America has become a passive experience for too many people. We sit back, we wait for things to break, and then we hope a specialist can fix them with a pill or a procedure. But true health, the kind of health that allows you to watch your grandchildren grow and live with dignity, requires active participation. Your body is incredibly resilient, but it is not silent. It is always speaking to you. It speaks in the swelling of your ankles at dusk. It speaks in the profound exhaustion of your mornings. It speaks in the heavy, terrifying pauses of your breath in the dark. It whispers for years before it finally shouts. We spend our entire lives building security. We lock our doors at night. We invest in retirement accounts. We buy insurance for cars we barely drive. We protect everything around us. Yet, we turn off the lights, lie down in the dark, and leave the one engine that keeps us tethered to this earth completely unguarded. If this conversation resonated with you today, I ask you to do 3 things. First, share this video with exactly 5 people you care about, people who need to hear this truth before it is too late. Second, subscribe to the channel so we can continue this journey together. And finally, leave a sincere comment below. Tell me your story. Tell me where you are watching from, and tell me what you want us to talk about in our next video. The night does not have to be a battlefield.